So, hello. Yeah, Miss Norman, are you
Hi.
there? Hi.
Yes,
All
I
right.
am.
Wow. So, first of all, thank you all so much for attending this webinar today. Really, really appreciate it. I would go ahead and introduce myself and then go ahead and introduce Ms. Norman, who would be taking us through a mental health education today. So my name is Osei Boateng, and I'm the founder of OKB Hope Foundation, a nonprofit that is really focused on bringing healthcare to underserved and rural communities in Ghana. So we do this through, going through our mobile clinic and providing primary and preventative care for rural communities. And as part of what we do, we are also passionate about bringing mental health into the youth. So we do a lot of health outreaches. And today we have the absolute pleasure to have Ms. Norma with us today, who will be taking us through a lot of mental health education. This session is meant to be more of a conversational, interactive section, so definitely feel free to push questions in the chat as we go through the session. And before I sort of invite Ms. Norman to take the stage, I will quickly introduce her. So just 1 minute. So Ms. Norman is a licensed clinical psychologist who holds an MPhil degree in clinical psychology from the University of Ghana. She has experience in teaching, research, and practice, and currently is working at the Berry Care Clinic in East Legon. She's a mental well-being advocate with a keen interest in adolescent and young adult well-being. As a mental health practitioner, she is also highly skilled and dedicated and compassionate, and also love to paint for fun. And so with that much ado, I introduce Ms. Norman today. So the structure of this section, as I alluded earlier, is going to be more conversational, more interactive. And so instead of having a presentation, we are just going to ask questions, and based on that, Ms. Norman will answer. And then, so anyone on this call today can put questions in the chat, and then we will take it from there. So, Ms. Norman, first of all, thank you so much for being with us today. We are really excited. We know that mental health is really needed, especially in our country where there's limited resources, for mental health. And now that we know that the theme for the Mental Health Day is that mental health, a universal, human right. So, Ms. Norman, I would like to know, we've been talking about mental health. So my first question to you is, what is mental health? What does that even mean?
Okay, so when you say mental health, I think a lot of people have the impression that it's an illness. I want to state categorically that mental health is not an illness. Okay. Mental health just involves how we think, how we feel, and how we behave. Okay, so our thinking, our feeling, and our behavior. And so with that said, it means everybody has mental health, right? Just like we have our physical health, we also have our mental health. And so our mental health is just as important as our physical health. A lot of the time, because we can see, our bodies, we are very conscious about it. We tend to take care of our bodies, we tend to take care of our physical health to the neglect of our mental health. Sometimes not intentional, it may be just a lack of awareness. And so mental health includes how we think about others, how we think about ourselves, how we feel about others and ourselves, how we relate to other people, how we cope with life's ups and downs, and then all of our emotions, right? And I'd want to say that mental health is not just about positive things in life, like being happy all the time and all of that. being happy is one part of it, being at peace is another part of it. But then mental health also includes our ability to react to negative situations. Let's say if your phone falls down right now, gets a crack, you should be able to feel sad about it or maybe feel upset about it. And that is normal. That's part of having a good mental health. You're able to regulate your emotions, you're able to react to negative circumstances when they come up. And so knowing how to deal with life's situations is also part of our mental health. You mentioned that our theme for this year is that mental health is a universal human right. Now, when you look at just the general definition of health when it comes to the WHO, they say that health is a state of complete physical, mental, and social well-being, not just merely an absence of disease. And so having mental health is part of being healthy. So you can't be healthy if your mental health has been neglected or if you are not conscious of your mental health, if you're not doing something about it. Right. And so with the accepting mental health as a human right, it means that we're acknowledging that it's important for us to preserve the emotional, the psychological, and social well-being of everybody. Yeah.
Awesome. Thank you so much. Thank you for the in-depth explanation of mental health. So I'm just curious. We know that mental health really basically affects, everyone. And they say that, at any point in time, anyone can go through a mental health sort of episode. But I'm just curious, how big of a problem is mental health in Ghana?
So when it comes to Ghana, I think a major problem is maybe we're not paying too much attention to our mental health. Like I said, it's about how we think, feel, and behave. And so it's normal, like it's a part of us. And so sometimes it's easy to really neglect and not really pay attention to it. So some efforts are being made to improve mental health in Ghana. You see organizations, companies taking initiatives for their workers, trying to get them programs. Even this particular platform is a good initiative to create awareness about mental health. So people are doing things that is commendable, but there's so much more to be done. Because when you look at the mental health burden, like when your mental health doesn't go well and now it becomes a problem, out of let's say 100% of people who are living with mental health disorders, I think the estimate is like 2.3 million. Only 2% of this number are actually actively getting health care from health facilities, right? Some people are in chains at prayer camps. Some people are home, locked up. Some people are on the streets. And so the neglect is there. So much needs to be done, although people seem to be making efforts. There's so much that needs to be done. And I think we can start looking at our attitude towards seeking help sometimes. Because on a normal basis, if somebody is going through a stressful situation or a stressor, or they've been abused or they're traumatized about something, they won't open up about it. And that is understandable because when you look at this whole problem, stigma is there. Some people feel that if they say they have a problem or they are suffering, they'll say that, oh, in our parents, maybe they are going mad or there's something wrong with them. So they might not be open to seeking help. And so it has to start from our attitudes as individuals. If you need help, you should be able to go seek help and get something done about your mental health. And so the problem is huge. Efforts are being made, but so much more needs to be done about it.
Awesome. Thank you so much for saying that. I like the point where you said that if you need help, seek help. And so I grew up from Ghana, and so from my experience, they said men don't cry, and so for me, it's very difficult as a man to seek assistance because no one wants to be vulnerable. Men are strong, and there's this whole conception about that. So what would you say about that? how would you encourage me, for example, to
I
be
think
able
that
to see?
this men don't quite think. That's why the men are dying. Men die faster than women with the rate, and they die younger than women, go older and all of that. I mean, if a woman is going through something, she can share easily, can call her friends, cry on the phone. It feels normal. But a guy call somebody and cry on the phone, I mean, it's another conversation. But then again, when it comes to, you can understand that your mental health is important. It's part of being healthy. You want to take steps to be healthy holistically. Then you take the steps to take care of your mental health. So, for example, we can normalize actions that take care of our mental health on a daily basis. We don't have to wait till we are in get fixed or we are struggling so much before we do something. If you are hungry right now, right, and you want to make yourself something, go and take a can of maybe milk and it's expired, you tell yourself that, if I take this, I'll get a stomach ache. You're thinking about your physical health, right? And so you would avoid drinking the expired milk. In the same way, if we know that our mental health is as important, then if we are going to do something or we find ourselves in certain situations, we won't allow um, negative things. For example, if you have a toxic friend or eh, you're in a toxic work environment, people are saying things, you will try to avoid them because you know that they will come and affect your mental health. Like they'll cause you stomach pain if you have to drink the milk. And so if we normalize daily actions that would help prevent us from struggling mentally, then we are likely to have better mental health outcomes generally. And so exercise, meditating, being mindful, these actions that you can take to protect your mental health, we have to do them on a daily basis. So it becomes normal. And so if you're going through something, you're crying, your friends already know that you do that to take care of your mental health. So they know that it's gone beyond, and so you really need help. Then it can help.
Okay, so you think men should cry? You think I should cry
If
when
you
I'm
need
going through it?
if you need to, I think you should open up. Crying is very cathartic, actually. Science shows that if you are overwhelmed, you just lay on your bed, cry, and sleep. So you wake up, you feel better. Yes. So if you need it, please do. Don't bottle up your emotions. The thing about mental health is, right, you might think that if you ignore the problem, it will go away. It may go away temporarily, but then when it comes back, it can come back at a magnitude that you didn't expect, and it will break you down completely. A lot of people who end up with, the major mental health disorders because there were signs over and over that they ignored or probably didn't really take care of, they didn't do much about, which has now gone beyond. And so when the final trigger, like my history, the straw that broke the camel's back, when that straw comes, then now it becomes a major problem that needs more attention, more money. And I don't think we should be doing that. So if we start small, every day doing something about our mental health, then we are less likely to get to the point where we're breaking down and we need so much help. So yeah.
Thank you so much, for that explanation. And I was like, last time I was reading another article and I came across this term, mental health disorder. And so I was kind of confused. So I wanted to know, is there a difference between mental health and mental health disorder? Or what is even a mental health disorder?
Okay. So like I mentioned in the beginning, mental health itself is just about how you think, feel, and behave. Now, the disorder is the condition that affects how you think, feel, and behave. Okay? So, when you get an illness of the mind that affects your feeling, affects your thoughts, and affects your behavior, those are the mental health disorders. And so, there are criteria for clinical psychologists. We use the DSM-5 to diagnose. So there are certain symptoms that should be present for a certain number of either weeks, months. There are criteria to follow, diagnose anybody with a particular mental health disorder. And so the person might be presenting with symptoms, but if it's not, depending on the kind of symptoms, there can be, let's say, a subcategory of the disorder. Okay, so it's not just when we see that, oh, maybe you are sad, you are crying, then we say, well, you are depressed. No, there is a criteria to follow. There are some tests to run, like psychological assessment tools that would use. Then, based on the clinicians' interviews and their judgment as well, then they can finally diagnose you. One thing about diagnosing mental health disorders is we try to do it with caution because of labeling. Right? If you tell somebody that, okay, you have this bipolar disorder, this is a label that the person is going to go with for life. Some mental health disorders are chronic. We can only manage them. They may not go away. And so you can't just, put a label on someone when you're not sure about it. And, right now, people go around and say, oh, I'm depressed, or I have anxiety, or, those things. We need to do that with caution because you never know how it's going to affect the person later in life. So there's a system to it. It's that do analysis. You do assessments, you do your own interviews, then based on that, you draw your conclusion. So when it comes to the mental health, sorry, yes, so the mental health, oh yeah, there are a number of them. I just wanted to mention a few so that we know, so there are common ones like the anxiety disorders. A lot of people know there's depression, there's bipolar disorder. That's a mood, more like a mood shifting from mania, being extremely happy, being depressed, and back. They are the heightened ones and the ones that are a bit mild. So it depends on which symptoms you're presenting. That comes with the diagnosis. Then there's post-traumatic stress disorder, PTSD, there's schizophrenia, eating disorders. They're also psychological disorders. And when I say eating disorders, it's not just about not being able to eat or eating too much. There is a criteria to it. Then addictive behaviors. I'd like to say that in our current time, sports betting, I'm sure there are a lot of addicts when it comes to sports betting now. So we need to check that. And then also some other conditions like ADHD, attention deficit hyperactivity disorder, autism spectrum disorder. All these are mental health disorders as well.
Wow. Yeah. So, wow. Thank you so much. I didn't know that there's that wide range of, disorders when it comes to mental health. So, here's my question would be, so what triggers these mental health disorders? What are some triggers or what
Okay. So, unlike physical health, where we can, some physical conditions, so you can say, for example, maybe this particular virus causing this particular condition. When it comes to mental health, it's usually a number of different things that come together. So the interplay of those factors, they can cause somebody to get a mental health disorder. And so one is hereditary. So you can actually inherit mental health disorder from your ancestry. So then it doesn't mean if, let's say, your parents had depression, you would also have it. It's not a cause and effect kind of thing. So it just increases your chances of being depressed when the circumstances are right, if I can say that. Okay, so it can be passed on. So when you have family members who also suffer some mental health disorders, then it's a sign for you to take care of your mental health so you don't end up there. And then sometimes our brain chemistry. So we have some chemical messengers in our brain, the neurotransmitters that influence our actions, our behavior, our thinking, and our feelings. So if there's something wrong with these chemicals, they are not in the right proportion, they are not balanced, working well as they should, then it can result in some mental health disorders. And for example, the mood disorders, particularly some neurotransmitters. And then other factors like stressful life situations. So let's say you already have a tendency in terms of heredity then your life is also you are very stressed, or you lose your job, or you lose a spouse. These things can also trigger the mental health disorder. Then sometimes chronic medical conditions. So for example, someone who's diagnosed with diabetes, they can start to worry about it. Their lives are changing, their eating patterns are changing, and all of that. Then they end up developing, let's say, anxiety disorder at the end of the day, or panic at the end of the day. So chronic mental conditions can also trigger mental disorders. Um, traumatic brain injury, when in an accident, a head bump, or someone punches you, it can trigger mental health disorder. Traumatic experiences, sexual abuse, physical abuse, they can influence it getting a mental health disorder. Like I mentioned, post-traumatic stress disorder is one disorder. So if you have gone through a traumatic situation, it can lead to that condition. Then having a childhood history of abuse also. Then having few healthy relationships. And this one, I'm saying it with caution. I don't mean that when someone will say, "Oh, I'm an introvert, so I don't have friends." That doesn't mean you are likely to get a mental health disorder. But if if you have healthy relationships, the positive thing about it is it builds your support system. And so when you're faced with life stresses, you have something to call on or people to call on. Right? But then if you don't have these healthy relationships, then there's no one. And so your likelihood to end up getting the mental health disorder is higher. Right? And then if you've already had a previous mental illness, the likelihood is you can develop either the same thing, a relapse, or another. But sometimes they coexist, they come together. Some people having anxiety end up developing depression alongside, or depression, then they get anxiety alongside. So all these things trigger or cause mental health disorder.
Awesome, thank you. So, let's say I have a friend, right, and my friend is going through mental health challenges. What are some signs that I can point out for me to see that, okay, my friend is actually having some mental health challenges? So in other words, what are some signs for these mental health disorders so that once we see it, we are able to approach the person and offer some assistance?
Okay, so I mentioned a wide range of, and the ones I mentioned are just few. There are so many more mental health disorders. So all of them come with their unique signs and symptoms. But then I just mentioned some general ones that we can be looking out for. So when someone or the person is feeling sad or down for a long time, again, it should be out of the ordinary, because if the person has lost a parent, obviously the person is expected to be sad. That's part of the normal mental health. You should be able to feel negative emotions as a result of negative circumstances. But if it's going on for a long time, it can be a sign of mental health disorder. Then experiencing excessive worry or fear about the future, or about some unclear reason. You just don't know why, but you're so afraid these days, or you're worried, constantly worrying about every single. It may be a sign. Then being unable to enjoy pleasant activities, and here obviously is subjective, but they are pleasant to you previous, but now you feel like I said, I love to paint. So then all of a sudden I don't feel like painting anymore, or I'm not enjoying it anymore. It may be a sign that I need to check on my mental health. Then having difficulty concentrating. You go to work, you can't concentrate, you're in class, you can't concentrate, or you're just constantly confused. You find yourself losing track of where you are. It may be a sign that you need to check your mental health. Then sleep problems. You might be either sleeping too much, or being unable to sleep, or not really, waking up in between your sleep is disrupted. That can be a sign. Eating problems, eating too much or eating too little. Then sometimes not feeling anything at all, right? It's not just about feeling negative or negative things, but sometimes just being blank. When you should be feeling something, you just don't feel anything. You're not happy, you're not sad, you're just there. It may be a sign that you need to check your mental health. Then not being able to share the joys and sorrows of others. And here it's not necessarily if somebody you don't like and the person is telling you they're happy and you're not happy for them. That's not the case. In this case, let's say your really good friend or your spouse has experienced something, but you can't really share the joy with them, or you end up withdrawing from family, you withdraw from friends, you withdraw from activities. Maybe you used to like going to church, but now every Sunday you just want to sleep, or you're not going for class, you're missing work. These are signs. Another sign could be when you're unable to cope with just your regular daily stresses or daily problems. You find yourself getting irritable, like everything feels so overwhelming, right? They are not every day comes with its own stress, but then when you start to feel like this is too much, this is unbearable, I can't take it anymore, it's a sign that you might be struggling with some mental health disorder. And suicidal ideation, suicidal thinking. When you think that the world is better off without me, I'm feeling very worthless. I mean, life, what is life about? I'm not making heads way. I'm better off dead. I'd rather kill myself than be here. Please speak to someone. It's very important. Speak to someone you trust. So, as a friend, you should be looking out for these.
Mm-hmm. Wow, great. There's one question in the chat that I would love to read. So, is it how is one able to overcome mental health disorders like anxiety or depression? If someone is having these signs, do the person need to see a psychologist, or are there some other ways the person can overcome that?
Okay, so if before you saw these signs, you could have been doing things to prevent them from, becoming full blown. But to be safe, see a professional, see a clinical psychologist or your general practitioner to assess you. Just like when you have, the regular headache, fever, you're not sure what it is. You can say it's malaria and such, but they advise that you should be tested so that you know exactly what you are dealing with. So if you start to see the signs, please reach out, see your psychologist, talk to someone, a professional, and have them assess you so that when you are getting the treatment, you know that it's targeted at the problem. You might be experiencing some problem that is causing you to feel the way you are feeling. So then the person can help you go through the problem. So it's not necessarily going to advise or maybe tell you what to do, but to guide you based on, the principles that exist so that at the end of the day, you would be able to cope better. And then you build skills and you build resources that would prevent you will be with you. And then the next time you're faced with a similar situation, you'll be able to handle it before it gets overboard and becomes another episode of either anxiety or depression. So reach out.
So that is very great. Definitely, it's very important that we definitely reach out. But I'm just sort of curious in terms of like sort of not getting into the full blown, let's say, anxiety and depression. What are some ways, because people can cope with that, because there isn't like a cure for, let's say, someone experiencing life-changing experience, right? Like it happens to us all, but most of the times it's more of like how we cope with it, right? So want to know like what are some ways we can cope with these challenges?
Okay. So it will be different for everybody. Again, even when you take anxiety, the story around someone's anxiety may be different from another person, and so coping would also be different. Everybody's different. So I would advise that you identify your strengths, okay? The things around you that are good resources. I mentioned the risk factors, but there can be protective factors as well. So around you, do you have a healthy environment? Do you have a healthy relationship with friends, family? Look for that. And then pay attention to the signs. Okay. So you are saying that you might be going through something. Pay attention. What exactly are you going through? Try to remember what caused it, what led to it, what happened before you started feeling the way you were feeling. Try to um, take cognizance of your own body, know yourself, and then know what is going on with you. If you know the signs and symptoms, then you realize that, okay, this is out of ordinary, this is not usual. Then now you should be getting your regular test. So when you go for your physical health, they encourage doing routine medical checks. We should also normalize routine mental health checks. When was the last time you had a mental health check, right? Normalize that. Go see a psychologist. You don't have to have a condition before you go and see a psychologist. Life is stressful enough for you to need someone to, share that burden with. And so try to make it a routine, checking your mental health. Then when you need help, try to take the step. Okay, don't be shy. Don't say, oh, I have to handle it. Reach out. Then take good care of yourself. And when it comes to taking good care of yourself, it comes with the regular eating healthy, sleeping well, exercising, doing things that make you happy, being in nature. All these things tend to build sort of um, a shock absorber. So when life pushes you like that, you've been exposed to these positive things, these calm things, you know how to relax your body. So you're able to easily reset, come back to a restful position. So it doesn't trigger an excessive emotional state where it now goes on to become a full-blown mental health disorder. So there are things that you can do on the daily that will be helping to build resilience. It can be protecting you, making your mind stronger so that when stress comes, you're able to deal with it. So you can start little, try something new, and then you'll be good to
Oh, I like the sentence that you made about we should normalize, checking our mental health, going for regular checkups for mental health. Wow. There's another question in the chat that says, if someone is angry all the time, can that be a sign of a mental health disorder?
could be a sign. So one of the signs are extreme irritability. You're angry all the time. Find out what is making you angry all the time, right? It could be maybe a personality thing. It could be, but anything that's affecting how you're thinking, how you're feeling, how you're behaving needs to be checked. It's about your mental health and you need help with it. Is it normal for people to be angry all the time? I don't think so. And so if it is not normal, you should seek help and know how to manage it, because being angry all the time in itself is not healthy for you, the individual. Maybe you're putting it on other people, fighting with everybody around you. But then even for yourself, it's not healthy. It's affecting your heart, because now your heart has to pump so much blood whenever you are aroused, you know, to face whoever is in front of you. And that can be putting a lot of pressure on your heart, your vessels, your brain, you know. So physically it's not healthy. Mentally it is not healthy, because anger comes with a lot of is a negative emotion. So you are fueling all the negativity. And human beings normally, we are negative in nature. We have a negativity bias, right? And so you need more positive experiences to sort of water down the negative. So if already you're negative and you are arousing yourself with so much negative, then you're not going to have a good mental health state. And I don't think it's healthy, either mental or physical. So you need to open up to someone to help you know how to manage it. So anger in itself is not a problem. Anger is usually a reaction to something. It's feeling abandoned, feeling lonely, to feeling that people are taking advantage of you. So anger is a reaction. To find out the underlying cause of the anger and then deal with that, then you realize that you're better off not being angry.
Wow. I know that Joy, you raised your hands, but I'm not sure if you still have your question.
Yeah, I still do, if you can hear me.
Yeah, we can hear you.
Okay, all right. Pardon me, I joined, I think, a couple minutes late. I don't know if my question has already been asked, but I just put it across regardless. I think I've heard Queen speak extensively about mental health, and I'm wondering, when it comes to therapy, like treatments of these mental illnesses, I'm not sure which term to use now, but whether mental illness or mental disease. Three different forms come to mind. I want to know, in her opinion, if she can, which of them would be the best to resort to? Is it medication, counseling, or, in a part of the world, prayers? I mean to say, as like spiritual solutions. Or exactly, which, in your opinion, which of these would you think is it a little bit of each of the three, all of them, or there's a particular one that stands out that is a good one to resort to when it comes to therapy?
Okay, so for me, I'm trained in using psychotherapy, psychological principles in treatment of mental health disorders. But then, depending on the condition and also depending on the intensity, there are best practices that suggest that you need medication and psychotherapy, for example. The combined effect is better than either of the two on their own. So, for example, if you take somebody who has, let's say, a major depressive disorder, and it's a severe case, this person needs medication because, like I mentioned, there are brain chemicals that have been affected in this case. So the medications come in to work on the chemicals, right? To give the person a sort of a balance, and now when you balance the chemicals, then you can now deal with the psychological part of it. That's the emotional bit, the thoughts that are running through the person's mind, or even the person's social environments, right? The people around, the relationships around, how is that also affecting the person? And so all these three that you mentioned, they all play their role, right? They all have a role they are playing. So psychotherapy like this, they are looking at the thinking, the feeling, the behaviors that are affecting you. So we can deal with this from that angle. The medications are looking at, the chemicals in your body that can be implicated in the disorder. When it comes to the spiritual angle, I'm not an expert in that field, and so I can't say that will make it go or don't go. But then, with what I know, even in psychotherapy, we encourage that if the person is, let's say, religious, spiritual, that is a resource you can fall on to help the person. Okay, there is psychology of religion where there are research that shows that the prayer does something to the limbic system in the brain. And so if we are falling on these resources, then we know that depending on what is affecting the person, what's the cause, the disorder, what's perpetuating the problem, what's making it stay and not go away, then we can help the person using the necessary angle. But maybe I might not be the person prescribing the medication. So we work with different professionals all come together, and then based on the person's deep condition, we all play our part to help the person have like a holistic care. And so I wouldn't say maybe a particular one is better than another. They are all playing their roles, and depending on the person's condition, each can work together to help the person better. I hope that answers the question.
Yeah, I see that he's showing some sign, because what you said is very interesting, because there is an interesting question that I wanted to ask about. I mean, definitely it's fine if you don't have the exact answer to it, because someone was wondering, like, is mental health disorders, can that be as a result of spiritual cause, especially since we've seen a lot of rise of like prayer camps and stuff. I mean, does that relate to mental health disorders at all?
So when it comes to mental health, the reason why we easily ascribe it to spiritual things is because we can't see, just like we can't see the spiritual. And if it's physical, they can, run blood tests and tell you that maybe this level of cholesterol or this level of that and that. So when you take this medication, it will balance. So it makes sense clearly for you, so you're able to believe it. But then when it comes to mental health, like I told you, the cause is not really direct. You don't know exactly what's going on. You can't see what's going on. And so if you are a spiritual person, it's easy to ascribe it or think that it's coming from that angle. And if you think that, then the likelihood is that you are going to look for the solution over there. Because those who go to the prayer camps, they think the solution is there or the problem is spiritual, so they need a spiritual solution. But can also come from a place of the lack of awareness. Okay? So conditions like schizophrenia, where the people lose touch with reality, so the symptoms can be delusion. Or, so if the person is delusional, they feel somebody is always following them. They are hearing voices. They're having hallucinations. It's easy to say that it's spiritual. People are, attacking them or ancestors are speaking to them and blah blah blah. So then they go there. But if they know that the symptoms of schizophrenia, which is a mental health condition, are these, and they can get help with medication and psychotherapy, then I think they would also seek that angle. And so the awareness needs to be created so that people know. Well, I'm not saying you shouldn't get your spiritual angle, but then if you're even going there, also go with the science and the medications and psychotherapy that exist. Also, so, I mean, you're not losing anything. In any case, you are gaining more because you are attacking the enemy from all angles. So I think you get better quickly. So yeah, explore.
Yeah, that's a great answer. So, I mean, since you've been talking about mental health and how you recommend or you recommend that people, I mean, do a regular mental health checkups. I mean, there's a lot of questions in the chat that is like, okay, so if you're telling me this, how is it easy for me to get access to a mental health consultation? Like, what is the cost? What are like the average wait times, or like even how many clinical psychologists are available in the country for me to even get access to it? So, um, can you give us some insights from that part?
So, so the truth is, in terms of the number of people who need care, we don't have as much professionals in the system to take care of it, right? However, even those in the system also don't get as much clients who need to come and see us. Think they have a problem or not willing to open up about it, or they don't want to be tagged as having, being mad, having a problem, or they don't want to be associated with. When you mention clinical psychologist or mental health, then everybody's running away. Some people even hide to go and see their therapist. That is how much people are trying to. But then if the conversations become open, right? Everybody is open, they are seeking mental health consultation, the likelihood is that. So we exist, that we are there, we would also be helping us because there's a lot of resources to go around. The clients are not coming in. And also when the clients are coming, it might make the field more attractive to people who want to practice, right? There are lots of people who graduate with a master's in clinical psychology, but the avenue, take them on. I mean, every hospital, every school, everywhere there's a human being, there should be a psychologist. But psychology is about human behavior. And so everywhere, and there are different types of psychology. But I'm a clinical psychologist, so I'm mental health angle. So we need to make it more. It's not as accessible. That's the truth. In terms of how widespread it is. You mentioned that you go to rural areas. I'm sure you know that they don't have as many psychologists in their hospitals over there. But then they can actually start. If you go to your general health practitioners, some hospitals have them. They will recommend them. They will refer you to see this psychologist, right? But you need to actually pay before you get the help. And I think some people are also starting tele-assistant platforms. That can also be an avenue to help with the accessibility because everybody's on their own. And so if you have your phone and there's a platform that you can quickly just hop on and get someone to help. So yeah, there's a lot that needs to be done.
So, yeah, there's a lot of work that needs to be done, as you said, to really make this accessible. But we definitely need to do our best in sort of educating and also providing more resources for people to at least cope or prevent before it gets into the full-blown one. But
exactly.
Yeah. There's another one that is very interesting. It says mothers normally go through a lot of stress and depression after birth. Is this a mental health disorder or is a regular postnatal sort of care effect?
So it is not regular because not all mothers go through that. I mean, you are supposed to give birth to your child, go home. There are daily stresses. Being a new mother, especially maybe as your first child, or even if it's your third child, it's a new baby, new characteristics and all of that. So it's a new situation. You'd deal with some stress. But then they are meant, so when they go through that depression we just spoke about, it's a problem. It's a mental health disorder. Sometimes it starts with postnatal blues, just feeling sad, not being able to take care of the baby. It goes away with time. But then it can become depression, right? It can become depression. And that one needs to be, the person needs psychological help, right? They need to take care of it. And when we look it up as normal, it can get that bad that the woman would not be able to take care of her baby at all. Some people go to the extent of hating the babies because of how they feel, right? And so it's not something to just be told with and say that, oh, it's normal, everybody is going through it. No, it is not normal. Please seek help when you see these signs. You have a wife, a sister who's going through that, encourage her to come up. If you leave it to her alone, already the symptom is that she's not motivated to do anything. So she might not want to now get up and dress up and go and see a doctor that I'm feeling sad. You know how it sounds. So you can accompany the person, you can encourage the person on their next appointment, maybe going to weigh the baby. Then they go and see the mental health professional to help them out.
Wow, thank you so much. There's another question. So one question is, please, are withdrawal symptoms related to mental health disorders?
So withdrawal symptoms in itself, you are used to something. I'm assuming it's withdrawal from either drugs or an addictive behavior. That in itself is a mental health disorder. The addiction to whatever you are withdrawing from. So the symptoms are just a reaction to you not having that thing for a period of time. Okay, so it may not be a mental health disorder if it doesn't meet the criteria of a mental health disorder, but definitely is a mental health challenge that you need to deal with. And so, like I said, we are not in a hurry to label people that, oh, you have this disorder, you have that disorder. But if you're struggling with your mental health, your emotions, you don't have to have a label before you seek help. Okay, come seek help. Learn a few things, a few coping strategies, skills that you can apply in your daily life that would prevent you from actually getting to the point of having a mental health disorder. So And I'm all for promoting mental wellness, right? Before it even becomes a disorder. Take care of yourself.
Awesome. I think that is key, especially with the limited resources that we have. It's very important that we push mental wellness. So another question that has in the chat is, in your opinion, do you think childhood experiences and exposures lead to mental health challenges or illness? If so, what can be done to assist such individuals?
So childhood experience have a way they affect you, or they affect mental health disorders. I mentioned that as one of the triggers or the causes of mental health disorders. The experiences that you have stay with you over time. And so if you are unable to process them or deal with them adequately, they now start to create some maladaptive behaviors. They start to behave in ways that are not healthy for you, but then they might just be a reaction or a defense mechanism to protect yourself from all the trauma that you've experienced over time. So say you've had strict parents or abusive parents, and so you've just become very defensive, trying to protect your inner child. And over time, as you grow, you become so closed up, and then it starts to affect other relationships. So although it's not intentional, it's not something like you're intentionally doing that, maybe hard guy, you're just protecting yourself. And so it would affect your relationships later in life. You're not having healthy relationships because you're not opening up to your partner, maybe your children, you're not opening up to your children, or you start to do the things that were done to you to your children inadvertently. And so it's important to deal with traumas, childhood traumas, just open up about it, share it, and get an understanding, and then you move past it. It doesn't mean you necessarily forget it, but then your interpretation of those experiences are different. Then they now become like growth points for you. So you know that, okay, went through this because of that and that and that. You get a better understanding of yourself and why you do certain things. And then in the future, helps you to know how to behave around people. And you might have better outcomes in life generally if you deal with childhood experience.
So I think a follow-up question to that from the chat. So I think the person wants to know from your experience and practice, have you come across like children with mental health disorders? And if so, like what age group have you seen?
So yes, children do experience mental health disorders. I've not come across a lot of them, but then, I mean, a child with ADHD, it's a mental health disorder, like I mentioned. Autism spectrum disorder, those are also mental health disorders. Children deal with it differently, and sometimes children are unable to, let's say, define or say exactly what is wrong with them. So the way they would express what they are going through will be different, and because they are not expressing it the way we are used to, especially let's say with parents and people around them, it's easy to ignore, push it aside as just stubborn, or hey, my child is shy, doesn't talk. He might be going through something, which is why he's withdrawn. And so as parents, we need to be constantly monitoring our children, like paying attention to the changes that come. They are growing and they are changing. But then is the change in the right direction? Is it because of something? Let's be more engaged in the lives of children so that we can let children talk if they are open, like if it's a safe environment. So create that safe space that would allow the child to open up whenever something is wrong. And so you easily be able to see what's going on and then deal with it quickly. Like before it follows them into their adult. Yeah, like a lot of.
Okay, awesome. Thank you so much for the explanation. So, I mean, I know you mentioned that we've seen a couple of children, but not a lot. But just out of curiosity, what age group have you seen? Like,
seven, I think at least 7 years.
So as early as
yes.
7 years.
As early as 7. And this was somebody who, child who was like extremely angry, so disruptive in class, which is why it was in the first. But then out of the story, you realize that things are going on at home affecting this child and they're behaving in it. So the reason why they are disruptive is because they're looking for a certain kind of attention that they are not getting, or out they want to express themselves and they don't do any adaptive way to do that. And so they end up being disruptive and everybody's like, oh, you're stubborn, they keep gaining. And yeah, maybe you just need help.
Yeah. So I think I'll pick the last two questions, and then we'll bring our section to a close. It has been a very informative and insightful one. So really enjoying the session here. But I know this question might shake some tables, but I guess the person wants to know. So the question is broken heart considered a form of mental health disorder? Because sometimes recovery can take years or never. I mean, yeah, so that is the question.
Yeah, that's definitely shaking some tables. I think that broken heart in itself is not a mental health disorder. I mean, based on the criteria that I have available, it's not classified as a mental health disorder. But then it can lead to, so it's a very easy trigger for a mental health disorder. So some mental health disorder that can come as a result of broken heart can be depression. Okay, now when the person becomes stressed, then that is the mental health disorder. Or when they develop anxiety, PTSD, that's a mental health disorder. Now, for example, the interpretation of the broken heart, the person feels like maybe I invested whole life, my resources, my everything into this relationship. I don't think I have prospects anymore. Maybe time. Let's say you've been dating for 10 years or 7 years, and you're older now. You spent all your time with this person, and suddenly you have to move on without the person, without your time, without your youth. Then you feel, worthless. Or if there was verbal abuse or emotional abuse, where the person made you feel less of a person, right? And they are leaving you on top of that. Now you carry that into your future relationship or even in your own life. You're like, okay, I'm worthless, nothing good can come out of my life, don't feel anything, then you sink into the depression. Or you develop post-traumatic stress disorder where you're having flashbacks about the insult, or you're having nightmares, you can't sleep, all those things. So the broken heart can be a trigger for mental health disorder.
Okay, awesome. So broken heart is not a disorder, but it can be a trigger to the mental health disorder. So I'll pick my last question from the chat. It says, in the society we live in, most parents are the cause of mental health disorders for their children. How do we deal with such parents and children?
This is a bold statement, saying that the parents are the cause of the mental health.
Maybe. Can you hear me? I think we lost Quinn. Can you hear me now?
Okay. Yes, I can. Can you hear me?
Cool. Yeah, we can hear you.
Okay, right. So like I was saying, I can't see whether the parents are the cause. But then what I can say is that the environment we find ourselves influences the likelihood of developing a mental health disorder or not. And so if you live or you grow up in an unhealthy home environment, then it's increasing your chances of developing a mental health disorder. However, there's a question because other people also grow up in hostile environments and they don't develop mental health disorders. Okay. So in addition to the environment, your personal characteristics also play a role. Okay. Have you developed resilience? Are you able to cope with negative emotions like I said, that is mental health. If you're able to cope with negative situations, you're able to regulate your emotions. If you get angry, are you able to resolve it? If something is bothering you, are you able to be assertive enough to communicate what is going on to get the person to understand? And all these things are skills that some people learn, some people don't learn. And that's because we don't really consider, we are not paying attention to the mental health. And so if people are paying attention to it, then we'll be learning these skills that would help to, build us such that even if the environment is hostile, it would not affect. That's not to say that we need to live in hostile environment. As much as possible, the environment should be conducive for children to grow well. So parents, again, should be aware of how their actions are affecting their children. Okay? They should be aware of how the environment affects children. Sometimes they will just install, and it feels normal in our African homes. But then some children, every child is different. So what one child can take, another child might be too sensitive to regulate that, insult. And so the interpretation of that insult becomes like, I'm a failure or that, and they carry that through life. Then it can end up developing into a mental health disorder later in their life. So that needs to be checked too. I think awareness is key. How your actions affect other people. You know that in circumstances. Be conscious about that.
Awesome. Thank you so much, for the answer. I know that we are at time, but definitely, since we have a lot of people online, I wanted to know, what are some key takeaways you would give to us as we move forward?
So I want to say that mental health is extremely important. It's as important as our physical health. The way you take actions to protect yourself, to prevent disease, prevent illnesses, you're sleeping in mosquito nets, eating healthy, you're exercising. All these things are protecting your physical health. Now you need to also take action to take care of your mental health. Engage in the regular exercise. Exercise is not just for the body. It also produces what we call endorphins for the mind, the brain. So exercise, be mindful, be present. A lot of the time we are either in the past or in the future. That's in our heads. Yeah, dwelling on things that have passed that you can't really change, or thinking about things that are coming, worrying about things in the future. But you are not there yet. You only have the present. So be in the present. Enjoy what you have with you. Be connected with the earth. Be connected with your environment, guys. Practice relaxation. Know how to regulate your own emotions. Okay? Become emotionally literate. Know yourself. Know who you are. That way you'll be able to know what you can take. You'll be able to create necessary boundaries. You'll be able to relate well with other people. Learn social skills, right? It doesn't hurt to be nice. You only build better relationships. And your life is better that way. So just try to surround yourself with positivity. And I think that if you take care of your mental health, I can assure you that it's likely you'd have great health as well. And
Awesome. Thank you so much for the great key takeaways. Once again, really, really appreciate your time. And also for our participant, thank you all so much, for joining today. And I hope that one way or the other, you picked something out of this session that you're going to take with you on, and most importantly, share it with your network or with your friends so that they're also able to take good care of their mental health. But